Concussions. If you shake it, you break it. What is a concussion? It's a mild traumatic brain injury caused by a bump, blow, or jolt to the head, or by a blow to another body part with the force transmitted to the head. The brain is the most fragile organ of the body. It has the same texture and consistency as jello. The brain sits inside the skull and is surrounded by cerebrospinal fluid, but it is basically free-floating. Sudden, rapid movements to the head or to the body that cause the head to move rapidly cause the brain to bounce back and forth against the walls of the skull. Because the brain is so fragile, these sudden, rapid movements can cause injuries. Your brain is made up of neurons and axons. Neurons are like houses, and axons are like telephone wires that run between the houses. So what happens when the brain gets hit? The brain squeezes, sending shock waves through it. These shock waves can stretch, rotate, or tear the telephone wires. When you damage the telephone wire, there's a lack of communication in the brain. That can cause surrounding houses to die. Additionally, when the telephone wires aren't connected to anything, they can die as well, releasing dangerous chemicals into the brain. Therefore, brain damage or symptoms can occur hours or even days after the initial injury. The most common way to get a concussion is getting hit in the head or falling on your head. This is called a direct blow. You can also get a concussion by an indirect blow. This occurs when force is applied to the body, causing the brain to move around inside the skull. For example, if during a soccer game a player collides with another player or falls down without hitting their head, they can experience whiplash. What's that physics law? An object in motion stays in motion until something stops it. In this case, the object in motion is the brain, and the thing that stops it is the skull. Factors that can increase the risk of concussions are having a history of previous concussions, being a younger age, females who have increased hormone levels, participating in collision sports, other medical history like migraines, having aggressive behavior, or being in a game versus practice, because games are generally higher intensity and more unpredictable. Are concussions really that serious? Between 1.7 and 3 million concussions occur every year. That's 2 out of 10 people. And those are just the ones reported. Many more go unreported because an athlete is afraid to miss any practices or games. Getting cumulative concussions can increase the risk of permanent neurological disability by 39%, and currently 5.3 million people live with a traumatic brain injury-related disability. If you look at the chart on the right, the NCAA did a study looking at how many concussions were reported between 2009 to 2014 by the thousands. Wrestling had the most, then hockey, then football, then women's soccer. And since we are talking about how serious concussions are, we need to be aware of second impact syndrome. This happens when there is a second trauma to the brain before complete resolution of the first injury. Second impact syndrome is considered a catastrophic brain injury because the brain will actually swell and deteriorate, making the signs and symptoms more severe. 65% of athletes who get second impact syndrome die. That's 1.5 times more deaths than from AIDS. Multiple concussions can also lead to chronic traumatic encephalopathy, which is a neurodegenerative disease. The symptoms don't usually come until years later, but the repeated blows athletes get in their sport can develop into dementia, Alzheimer's, or multiple sclerosis. If you look at the picture in the bottom left-hand corner, this is a picture of a boxer's brain. Concussions used to be called punch-drunk syndrome. This is because it was very common for boxers to get punched in the head and then act intoxicated. The brain on the left is a boxer in their 20s. The brain on the right is the same boxer now in their 60s after they've had punch-drunk syndrome multiple times. In high-speed cases, the brain could swell and bruise. However, in low-speed cases, nothing will be visible. So imaging is not often done in cases of concussion unless it's severe. Rochester University just signed a new contract this year with Sway Medical, which is a mobile app that provides baseline and post-injury testing. It uses words, patterns, and numbers to test reaction time, memory, impulse control, and visual motor speed. There's also a section where we can test balance. RU requires all athletes to have a baseline test, so if an athlete does get a concussion, we have a norm to compare it to. It's not a pass-fail test, we just look at how they do. We also use the SCAT-5, which is a secondary evaluation that looks at previous medical history, signs and symptoms, neurological and cognitive status. It is an evaluation based on the most current research and is updated every year. Every certified athletic trainer at every setting and level uses the SCAT-5 to help diagnose and treat a concussion. So if you are at an away school and one of your athletes gets hit, the athletic trainer there will use the SCAT-5 to help diagnose your athlete. Here are the signs and symptoms of a concussion. Michigan state law says if an athlete is removed from play under suspicion of a concussion, the athlete is not allowed to return to play for the remainder of the day or until cleared by a medical health professional. Now, you might hear Rachel or Kara say, "I'll recheck them tomorrow and let you know." Or you might have an athlete who they thought got a concussion from a game, but were cleared the next day without going through the return to play protocol. That's because the first 10 symptoms on this list are also those of dehydration, heat exhaustion, and diabetic shock, to name a few. There are a lot of repeat symptoms for a lot of injuries. It's also possible that some symptoms don't appear until up to 24 hours after injury. At the same time, not all symptoms have to be present for a concussion. Each concussion will be different for each individual. Kara and Rachel will do their best to get you the most accurate info as soon as possible, but you may need to work with them. This is a list of some of the more severe signs and symptoms that should raise an alarm. If the athlete is experiencing any of these listed here, they should go to the ER immediately. So what do we do for treatment? Number 1, rest. And that doesn't necessarily mean sleep all the time. It means avoid the stimuli that causes increased signs or symptoms. For example, if it hurts to stare at your laptop or walk around for more than 20 minutes, don't do it. Number 2, rehab. In recent years, studies have shown exposing a patient to a stimuli to the point of signs or symptoms but not past can help alleviate them faster. So once the athlete's symptoms are stable, though not necessarily symptom-free, they can do things such as run through multiplication tables or play a memory card game under the supervision of a medical health professional. There are a few physical therapist offices in the area, such as HealthQuest, that specialize in concussion rehab, so in the most severe cases, we can refer the athlete out for more aggressive treatment. Number 3, having a good diet and drinking enough water is also important. Like with any injury, the body needs to heal itself and therefore is going to require more fuel. If the athlete is experiencing a lot of pain to the point where they can't sleep, they can take acetaminophen like Tylenol. We would like them to refrain from this as much as possible so we can monitor the signs and symptoms. And no matter what, no ibuprofen. Ibuprofen is a blood thinner, so if they do have a bruise on their brain or it's bleeding, taking an NSAID can make it worse. This is the return to play protocol used at Rochester University. When the athlete is asymptomatic, meaning there are no symptoms, they can start the return to play protocol. As you can see, there are 7 phases. Notice though, it does not say day 1, day 2. It's phases because if the athlete gets signs or symptoms during protocol, it will take longer than 6 days. For example, if the athlete is on phase 4 and gets signs or symptoms, they will stop for the day, and the next day they will do phase 4 again. They do not need to start all the way back at the beginning. The return to play protocol must be supervised by a medical health professional, which is Rachel, Kara, or a doctor. Also, keep in mind, if the athlete goes to see their own doctor and is cleared by them, they will still be required to complete the return to play protocol with Kara, Rachel, or the team doctor because RU is liable for the athlete. Rochester University now has return to learn policy in place for those students who are struggling with class while diagnosed with a concussion. Rachel and Kara can make recommendations to the professors based on the athlete's signs and symptoms. Luckily, the professors have thus far been really good about working with the sports medicine team and the students to ensure they are healing and not falling behind in class. Is an athlete more likely to get another concussion if they've already had one? Yes. As discussed in previous slides, when axons get damaged and have to repair themselves, it changes the chemical makeup of the brain, making it 4 to 6 times more likely to get another concussion. There is no way to completely prevent concussions, but steps can be taken to help reduce the number and severity of them. The most important prevention is education. Education for coaches, athletes, referees, administration, even the sports medicine team. It's important to know what causes concussions, when an athlete can get one, what to do when they have one, and stay up to date on any changes to the above. Also, properly fitted equipment could limit some of the forces applied to the head that could cause concussions, like mouth guards, helmets, or specific concussion bands. If you have any questions about concussions, signs and symptoms, return to play, or anything, feel free to contact Kara or Rachel.